My name is Rebecca Abdallah, formerly Malcolm, and I'm not as ingrained in the research world as I once was. I'm currently working as a healthcare coordinator for adults with disabilities at a series of group homes in Ontario. So I am more in the healthcare disability advocacy sector these days. So our article is called Work-Related Factors and Pregnancy Outcomes in Female Surgeons. And we were looking at primarily obstetrician gynecologists in Canada because we were working with the Society of Obstetrician Gynecologists of Canada. And we were looking at both maternal and infant outcomes, as well as the work-related factors associated with those pregnancies in their workplaces. And so we found, supportive data that supports what we kind of already knew, that longer work hours were associated with some adverse outcomes, and particularly miscarriage. But what I thought was more interesting was our policy research that we did. So we looked at maybe 450 some pregnancies, and out of all of those, only 28% had a workplace policy for reducing work while pregnant. And furthermore, those who worked in a workplace that had such a policy were much more likely to reduce their hours while pregnant. I was actually a student when I was working on this. I was a student finishing up my undergrad at Queen's University in Kingston. And I was working with a really wonderful supervisor, Dr. Susan Brogley. And at the time, I'm about to graduate and I'm going to pursue a career in healthcare. And so I was quite interested in some of those inequities that you see when you think about women working in high demand sectors like healthcare and those who want to family plan, because I knew I wanted kids at some point, but I also knew I wanted a career in healthcare. And so that was something I was really, really motivated with. And my supervisor was quite connected with a lot of surgeons in the area. And so it kind of just came together like that. And, now I'm pregnant right now with my first child, and I work in the healthcare sector. And so this research today, it's funny, we did it, 5-6 years ago, but this research today, it feels very relevant to my life right now. I think anytime you're looking to publish, you're looking at the journal itself as well, and definitely the audience of the journal. We were looking at a surgical population, so a surgical audience makes the most sense for this, but also the scope. So when you're looking at a journal and you're looking at publishing with them, when you look at the articles that have been recently published, I know that Annals of Surgery Open has an educational and a historical focus. And I think that was important to us because while, yes, we were doing some clinical bits about, adverse outcomes and things like that, the more meaningful data was for sure more on an educational side and a policy side. And that really fit, especially at the time, with what the journal was publishing. So I found the publication experience really, really helpful and really, really informative. When you're young and you're just getting started in the research world, I think you hear a lot about how challenging the publication process can be, and it's good to be prepared for that. But I definitely found the peer review process really helpful. When I, look at the document we got from our reviewers, one of the great things was that we had a lot of really positive feedback and reinforcement. Quite a few of the reviewers commented on, how valuable the research was, and so that was very validating. But we also had some questions, particularly about how we defined things, which was really helpful because it forces you to go back into your article and be very, very clear in how you're explaining how you defined things, what methods you used, making sure that you're extremely transparent with how you came to those points, and also a lot of statistical reworking. Absolutely. I would definitely consider publishing with Annals of Surgery Open again, for sure. It was a lovely experience. And I also know that there's a lot of really cool tools nowadays when you're submitting for publication that I don't think we had access to back when I was originally publishing. So I would definitely be interested in using some of those tools as well.